John Feather, the CEO of Grantmakers in Aging, and I want to welcome you to this webinar, which was designed by Funders for Age-Friendly Communities, which is a GIA initiative supported by grants from the Pfizer Foundation and United Way Worldwide. I do want to thank Barbara Greenberg and Jan Schwartz for their work in helping to organize today's session. And today's session is entitled Finding the Best Lead Agency to Make Your Community Age-Friendly. As a funder, you know that it's often difficult to know the ideal grantee to take the lead in your community to make it more age-friendly. Today's webinar will explore several types of organizations to consider, including a larger nonprofit, a community or university, your area agency on aging, and your regional planning organization or other governmental body. And we are very, very pleased to have 4 experts who represent those 4 types of organizations. With us are Kathy Boyer-Schessel from the Kansas City Communities for All Ages Project at the Mid-America Regional Council in the Kansas City region. Stephanie Firestone is Director of the Livable Communities Project at the National Association of Area Agencies on Aging. Alan Delatorre is the Age-Friendly Portland Project Manager at Portland State University's Institute on Aging. And Lindsay Goldman is the Age-Friendly New York City Project Director at the New York Academy of Medicine. And we welcome you all. Kathy, let's start with you. Tell us a little bit about the kind of organization that you work for and why your organization has been a good place for organizations to look for leadership in age-friendly community work.
Thank you, John, and good afternoon, everyone. Mid-America Regional Council, which going forward I will refer to as MARC, is a nonprofit association of city and county governments and the Metropolitan Planning Organization for the bi-state Kansas City region. And if you would go ahead to...
Stephanie, you're still with us, right?
I am.
Could we go ahead and move forward the slides and move on to Stephanie and then come back to this first part of the presentation?
So in the interest of time, I'll go ahead and jump right in. Thanks for having me on the webinar today, and good afternoon, everyone. Our members at N4A, I'm representing the National Association of Area Agencies on Aging. Our members are the Area Agencies on Aging, or what we call AAAs. The AAAs represent a single point of entry, connecting people locally to needed home and community-based services. So nearly 3/4 of AAAs also function as aging and disability resource centers, which is kind of a highly visible and trusted place where people can go to get information and one-on-one person-centered counseling. And that actually serving as an ADRC, an Aging or Disability Resource Center, is up from less than 9% of AAAs that perform that function in 2008 to today, 3/4 of those AAAs. So that's a big function of what we do. There are 623 AAAs serving older adults in virtually every community in the country, and AAAs vary widely in size because each state determines how many areas to establish, which then directly affects the number of operating AAAs. So just by way of example, Wisconsin has 3 AAAs, but New York has 59. Could go on to the next slide, please. So the Older Americans Act is essentially foundational for all AAAs, but since the law calls for local control and decision-making, AAAs adapt to the unique demands of their communities to provide innovative programs that support health and independence. That's why we like to say that no two AAAs are exactly alike, and why we say that AAAs are a national network with a local flavor. Can you press the graph, please? So the graph coming up gives you a sense of the structure of AAAs. Essentially, nearly 40% of them operate as independent nonprofit agencies, 28% as part of a county government, 26% as part of a council of governments or a regional planning and development area, only about 3% part of city government, and the remaining 4% is others, a nonprofit like the United Way or a university. Next slide, please. So we were asked to explain why AAAs. So first of all, the first bullet would be experience. N4A has engaged AAAs in livable community work for over a decade through national community surveys, learning collaboratives and technical assistance, workshops and town hall meetings that engage local leaders, as well as seminal publications. In our last survey, a reported 70% of AAAs have begun taking steps to develop livable communities. And N4A's recent report that you may have seen, Making Your Community Livable for All Ages, What's Working, is based on our experience working with numerous local communities and provides guidance to local change makers on the strategies that are really succeeding to advance this agenda at the local level. The second bullet is diversion from institutional care. So for AAAs really understand the needs that are in their particular communities to support people being able to stay in their homes and communities as they age. For example, by providing options counseling, prioritizing services for those at high risk of nursing home placement, and providing supportive decision-making, AAAs can divert people from institutional settings and help them stay in their homes for longer. So in 2008, less than one-third of AAAs provided diversion services, and today 70% are doing so. Next, please. Partnerships. On average, AAAs have 11 informal partnerships, usually with long-term care facilities, and you could bring up the graph here, please, emergency preparedness agencies and advocacy organizations, and they have a number of formal partnerships, most often with state health insurance assistance programs, that's SHIPs, transportation agencies, and Medicaid. So really on the substantive side, 81% of AAAs address housing, transportation, land use, and other development issues with other public entities in their community. 54% of them engaged in coalitions to promote coordination across service areas, and 50% of them have developed projects to promote aging in place. Next slide, please. Another reason for AAAs is volunteerism. So AAAs serve as a conduit to engage older adults in the community. And you can bring up the graph here. AAA's staff on average consists of 22 part-time staff and 41 full-time staff, but 167 volunteers. So N4A has also developed and trained a number of AAAs to use a unique model that we call self-directed volunteer teams, which takes advantage of the tremendous assets that older adults represent and really empowers older adults to advance livable community objectives in their communities. And the last point really has to do with sustainability. So support for AAAs undertaking livable community work has the potential, and actually to date has proven, to reshape some of the work that the AAA does, such that even after temporary funding infusion ceases, the shift in the continuing work of the AAA makes livable communities work more sustainable. Next slide. So we were asked also to talk about some of the questions that you might want to ask organizations that you're considering funding in your community. The first one has to do with the knowledge of the local population. So are they familiar with the aging population in the community, as well as knowledge of aging and aging trends and aging services like the providers in their community? The second bullet would be knowledge of planning. Do they understand the opportunities that are inherent in and how to work within the constructs of community planning to help create and integrate housing and land use, transportation, economic, social service, and health systems so that they support a high quality of life for people of all ages and abilities? The third point would be structural capacity, their organizational resources. What resources do they have at their disposal, and are they resilient or adaptive? Do they have adaptive capacity to address the changing needs and goals of aging populations? Next would be what I referred to again as experience in 21st century use of older adult volunteers, since essentially much of the actual work that needs to get done will be done by volunteers. Next would be, I would ask them about experience in organizing. So they really need to know how to identify appropriate roles and specific tasks for each of the newly recruited partners or stakeholders that they bring to the table. They need to know how to build people power. And in community organizing, they talk about the ask that you're asking of people has to be aimed both at their heads, so how they do the work through research and analysis, strategic planning, as well as at their hearts, really understanding why people are motivated to do the work. So organizing experience is really critical. And then finally, as I indicated before, they must have relationships with key players in other sectors who can then become champions. So through advisory committees or the boards of directors, or if a AAA is housed within a Council of Governments, as Kathy in Kansas is, which she'll talk about when she gets back on, the AAA can have ready access to key players and has standing in the community at the community level. So that would be a question to ask is, does the organization engage regularly in that kind of relationship building? Finally, I just want to present my, the contact information and the N4A website where you can get to a lot of really interesting information. First of all, I was asked, how do you find your local AAA? So while only designated AAAs can use the Area Agency on Aging name, not all AAAs use Area Agency on Aging in their operating name. So the easiest way really to find a local AAA is to go onto our website, n4a.org, and there's a really easy-to-use web widget right on the website's homepage. And finally, just to bring up the cover of the report, which came out in May, Making Your Community Livable for All Ages, What's Working, has clearly struck a nerve with communities that are seeking guidance on this. It's been downloaded over 100,000 times in the first month after its release. And you can also get directly to that report via our homepage. There's a link straight to the report. Thank you very much.
Well, thanks, Stephanie. That's a very useful and rapid background for the AAAs, and thank you for that. For the sake of just continuity across our slide presentations, why don't we move to Alan and have him discuss the perspective from the university setting. But I also want to remind our audience that we will be answering questions at the end of the hour. Please go ahead and start typing those in the Q&A box that you see there, and we'll be responding to those after our presentations are done. So, Alan, we'll turn it over to you.
Wonderful. Thank you very much, John. I'm very excited to talk about the university as a lead organization for age-friendly community projects. And just to make sure we're on the right slide, as I said before, the power is out in my university building at the moment. There should be two images, one that says, "Let knowledge serve the city," the other of an urban, what we call our urban center here. And I think I'd like to start by noting that universities come in many shapes and sizes. So here in Portland, we're a very urban university that's integrated within the city. I just got back from a trip to England, and they're very different layouts as well, but we really value the type of setting that we have here because we're able to work with partners, be right downtown, work on urban design issues, which is really exciting. And to talk a little bit about the image that's on the left of the screen, we are lucky here in that our university's motto is to let knowledge serve the city. So working on age-friendly community projects has really been kind of right up our alley. And then the image at the right, this is our urban center, which brings together not only the College of Urban and Public Affairs, but the College of Social Work and our long-distance technology centers, so we're able to reach out to other parts of the country and other parts of the world. If I could advance to the next slide, please. A little bit of introduction and context on the institute where I am. So I currently serve as a research associate in the Institute on Aging at Portland State University. We are one of the longest-running institutes on aging on the West Coast. The Institute on Aging is part of the School of Community Health in the College of Urban and Public Affairs, and this is important because our college houses 3 schools. Not only health, which helps us in understanding the health and all policies perspective, but government, which has taught us some key lessons in working with local elected officials, understanding the urban growth machine and the political economy of cities, as well as the Urban Studies and Planning Department, which has given us a more technical set of skills when it comes to planning, land use, zoning. So it's really helpful for me in the Institute on Aging and in health to pop down to the 3rd floor, ask a little bit about the history of a partner city or the way that our land use policies work, or head up to the Center for Public Institute or the Center for Public Service to talk about how we might be able to move programs forward in partnerships with private organizations as well. Portland State has been coordinating Portland's age-friendly efforts since the initial project in 2006. This actually is a good reason to think about universities. We were invited by the World Health Organization in 2006 to join what was a research project at 33 cities and 22 countries, and we were invited as researchers, bringing forward what was our skill set in understanding how to conduct research and how to take that research and move it forward into the implementation of findings and moving toward eventually what was the action plan for an age-friendly Portland. Please advance the next slide, and the next 2 slides are really getting at some of these questions about why are universities good organizations to be the lead of an age-friendly project. And the first is really getting back to why we were involved from the get-go, and that's the research capacity. So we look at how can we frame good questions? What are the answers that we are able to use to inform future processes? And we're always coming back to, is what we're doing reliable and is it valid? And it really gets as well to that second point on the slide of objectivity. So while we might have a research agenda, such as how are we able to move our city toward becoming more age-friendly, we come at this in a very objective manner. We don't have agendas that are tied to politics or to profit. The third point is really at the heart of where I sit in the College of Urban and Public Affairs, in that the multidisciplinary collaborations that we bring to the table can be quite robust. And I'd like to actually point to a new effort that's happening here in my university to elucidate how this is working. So the College of Urban and Public Affairs Dean has recently started convening meetings with all of the deans across our university to talk about aging across all of these disciplines, whether it's liberal arts and sciences or engineering, and to be able to think innovatively about how we're able to come to solutions and next steps with the different expertise, substantive interests that lie within the university. The next point is that students are actually a valuable resource when used well. I started in 2006 on this project as a graduate student and have evolved to make this my career direction. I now describe myself as an urban gerontologist, and coming through an urban studies program, it really made a lot of sense. But since then, I've been able to teach classes, not only capstone service learning classes that get students into the community really trying to create or carry out service projects, but we've also worked with graduate students who've been able to do research papers and literature reviews and really backfill some of the information that the faculty aren't always able to do because of the pressure that they have from other time commitments. With respect to faculty, looking for and finding tenured faculty that could have a long-range commitment to these types of projects is really helpful. So for me in particular, Margaret Neal, who is the director of the Institute on Aging here at PSU, has really found that age-friendly is her research agenda. It is evolved from what used to be caregiving and sandwich caregivers to really understanding the importance of aging in cities and aging in communities and seeing the value of this as helpful not only to Portland but to the world writ large. Then just to tie up this first slide, the great thing about university researchers is the depth of knowledge that is there and really the focus in studies that can kind of come to really be helpful in an age-friendly initiative. For instance, as an urban planning scholar, urban studies scholar, policy and implementation of policy are things that have been really helpful in understanding to make tweaks how to move forward an agenda that may be sometimes difficult in an action plan or in a visioning plan, to really know how to be successful in getting from a high-level concept to a change in policy, implementation, or programs is really quite helpful. So next slide. So with respect to the information that's needed from the university, one important question to ask is what are the overhead costs or the indirect costs? These vary from university to university, and it's important to know if they match well with the funders' policies, operations and policies. Also, how invested are the administrators? So we find that our new dean has been a wonderful ally in moving the aging agenda forward. Another question to ask is whether fixed-term faculty are involved, and if so, what are their long-term interests in a project? So I'm a fixed-term faculty member in that I'm not tenured, but I have a passion and a commitment to age-friendly, and so I've kind of stayed on board even though the funding is only perhaps year by year or in 2 or 3 year chunks. It's the substantive agenda on age-friendly that's most important. Another question is how does the department value community-based learning and or do they have a track record with translational research? And it's very important to point out that oftentimes tenured track faculty are reporting to a tenure and promotion committee, and publishing, getting into journals and bringing in dollars is really at the top of their priority list. So if there's a value for this community-based participatory research or looking to translate research findings into policy and practice, that can be very valuable for funders in understanding that what they're doing is not just an ivory tower exercise, but really leading to tangible outcomes in the community. And then next slide, which should be the final slide, there are a couple more questions or information that could be helpful. The first is whether there's substantive knowledge in aging or gerontology. So are there departments, either life course study departments, institutes on aging? Is both gerontology and or geriatrics something that's looked at, with geriatrics being much more clinical in nature and gerontology being social and dealing with a wide range of issues that are not using more of a medical approach or clinical approach. Also, does the faculty or department have experiences with advocacy, policymaking, and engaging with elected officials? And I'd say that this was really interesting to be a part of an age-friendly initiative, whereas when we first started, we're not really trained as academicians into how to do advocacy and definitely not how to engage in politics. And to a certain extent, policy is part of our bailiwick, but knowing and understanding if there's that ability for those researchers, those faculty members, to really to know how to advocate and navigate those systems in some way that you can be effective is quite important. And then the last piece has a lot to do with what the Portland University-City Community Partnership model has really become. And that is a collective impact approach. So we are moving toward a consolidated goal of making an age-friendly city, now an age-friendly county, and potentially an age-friendly region. And we convene the partners from the government, nonprofit organizations, and community members around that goal. So the Institute on Aging at PSU has become the backbone organization that has really continued to move this agenda forward through thick and thin, and it's been very helpful to have that institutional support in order to move this forward. That being said, it's very difficult for universities often to find the type of operational support that's necessary, and it's something that's needed within university settings for age-friendly communities moving forward. So that's the end of my presentation. I thank you all and look forward to some Q&A.
Well, thanks, Alan. That's a very useful. Portland State has obviously been a leader in this from the academic point of view, and an organization that GIA has had the honor to work with. Lindsay, let's move on to you, and then we'll come back to Kathy, who was able to join us. Lindsay, why don't you talk to us a little bit about the New York City experience?
Sure. Thanks for the opportunity to speak to all of you today. So the New York Academy of Medicine is an independent, nonprofit organization. We've been around since 1847, and we work to advance solutions to improve the health of people in cities. We do this through research and evaluation, policy leadership, advocacy, education, and community outreach. One of our priority areas is healthy aging, and we are the WHO's collaborating center on aging, urbanization, and globalization, as well as the implementer of Age-Friendly New York City, which is an ongoing partnership with our City Council and our Office of the Mayor to enhance all aspects of city life for older people. Next slide. So the Academy began working with the WHO in 2006 to identify the criteria for age-friendly cities. We were involved in analyzing the data from those first 33 cities that were mentioned earlier. And then we started implementing the model beginning in 2007. There were three main reasons why our elected officials considered such an initiative when the budget was very tight. First, there was a projection of a 40.7% growth rate in the number of older people over the next 2 decades. Second, this cohort will be one of the most diverse groups of older people in the world. Half of the older people in New York City were actually born outside of the United States, and close to 30% don't speak English so well. And finally, older people live in virtually all parts of the city. They vote and they buy locally. So we started by talking to thousands of older people, which we continue to do today through community consultations, surveys, and focus groups. We then created a findings report that we presented to our elected officials. And at that point, Mayor Bloomberg convened 13 city agencies to explore what they might do differently, either from a programmatic or capital investment perspective, that they already had planned if they just took the needs of older people into account. And from this came a commitments report with 59 initiatives to improve the lives of older people. And a multi-sector commission was seated to oversee these 59 initiatives, as well as to ensure the penetration of age-friendly concepts into the private sector. And the New York Academy of Medicine is the secretariat of this commission. Next slide. Through citywide policy work, working directly with communities, and by leveraging existing resources and opportunities, we've made some significant improvements to city life, some of which are detailed in the slide that you have in front of you. And the Academy is well positioned to do this work, given our role as a neutral convener and our three-pronged approach to addressing complex issues of urban health, which is that we review existing evidence and data, we consult with the people who are directly affected by any given problem, and in collaboration with those people, we convene all relevant sectors to develop creative solutions collectively. And the social determinants of health provide an underlying framework for all of our work. Next slide. So why is a nonprofit a good potential lead on an age-friendly initiative? Well, first, they can be flexible in ways that larger institutions may not be. They're often more nimble with respect to their bureaucracy, their procurement, and fundraising. They can potentially be more innovative as a result. They can be responsive to emerging needs very quickly. So, for example, after Hurricane Sandy, the New York Academy of Medicine was able to convene healthcare leadership to identify the immediate research priorities which emerged out of the storm, and then to begin a year-long study on older people in disasters. And this led to the incorporation of resilience-building principles into age-friendly New York City's work. Nonprofits often have the trust of the community because they're embedded in their communities and they have the requisite cultural and linguistic competence to engage with and organize communities. And they have significant human and financial resources which they can stretch in ways that are very creative out of necessity. Next slide. That said, there are some challenges to a nonprofit lead agency. Nonprofits are often under-resourced and understaffed. They have very limited funding for general operating support, and they have people spread across different projects. There's often high turnover, especially when nonprofits have been around for a while. They may be wedded to old ideas, systems, and structures, and reluctant to see things in a new way. They may have limited capacity for data collection, analysis, and evaluation, which a larger university might have. They may lack the reach into the private sector that's required to create a truly age-friendly city. And as with other organizations, sustainability is always a challenge. Next slide. So in thinking about a nonprofit lead agency, the questions that I would recommend to funders is, First, how do you see your role in the community? Is this an organization that's providing a direct service? And if so, what populations are they serving? If multiple populations are served, I would want to know how those populations were integrated, as well as what experience the organization has with community engagement and organizing. I would ask about the guiding principles for practice. If they don't have any, that's a red flag. But you're looking for, a strengths-based orientation, and you're trying to ensure that, they're seeing this from that assets-oriented lens rather than seeing an age-friendly initiative as a purely needs-based and predominantly focused on service delivery kind of thing. You want to ask about their private sector relationships and whether they're part of any sort of network. Before funding any age-friendly initiative, I would want to know if there is a commitment from local government to actually undertake this work. Because I think it's really essential that the people with the power to make the necessary changes to create an age-friendly city are actually at that table. I would want to know about the cultural and linguistic competence of the organization and to what extent the organization sees its role or if sees one of its responsibilities as conducting outreach to those people who are not its clients, especially if this is an organization that delivers some kind of service. I'd want to know who they consider to be stakeholders in an age-friendly initiative, because at its core, age-friendly is a multi-sector approach, and so it's important that that perspective comes through. And getting back to the private sector issue, I would want to know how they plan to leverage their board of directors. One question that I would definitely think about asking is, if you're awarded funds, what's the first thing that you would do? And from this question, you can get at whether this is an initiative that's going to be driven by older people, or is this an initiative that's really going to be driven for older people? And the preference, of course, is, older people should drive age-friendly initiatives. And I would also ask about, benchmarks for success. How will you know when you've achieved a certain level of age-friendliness, and then what? So that's really all that I had. My next slide is my contact information, and I'm happy to answer any questions when we're done.
Well, thank you so much, Lindsay, for that insightful review of working with nonprofit organizations in this capacity. I believe Kathy's back on the phone with us, and if we could go back to slide 2.
Great, thank you. And apologize. Hopefully that won't happen again. As he's going back to slide 2, I'll just again reiterate that MARC is a nonprofit association of city and county governments, and we are the area regional council for our area. We also serve as the Metropolitan Planning Organization, which is a transportation planning. And MARC also serves as the area agency on aging for the Missouri side, 5 counties on the Missouri side, which I recall that Stephanie mentioned. Kansas City's Age-Friendly Initiative was initially sponsored by a local nonprofit, and after 4 years, the project was transitioned to MARC. Through the initial 4 years, significant awareness was built on the changing demographics and key issues to address aging in place and aging in community. Also during this time, Kansas City was a recipient of a Grantmakers in Aging engagement grant that allowed a core group of funders to elevate age-friendly communities on the agenda of civic leaders. These two efforts, when combined, led the principal funder to approach MARC to take on sponsorship of the initiative, largely due to our region's growing awareness of the importance of local municipalities taking ownership of age-friendly communities. So an area regional council might make sense to fund age-friendly city work when the project or program is regional in scope, requires or could benefit from connection to local governments and other public agencies, is funded in part with federal or other public funds, or has a complex funding base where a regional council's financial management systems could be helpful in careful tracking of resources, or need a neutral convener sponsor for a program. Regional councils usually have data research capacity and sometimes capacity around communications or training. And if you could go to the next slide. A few characteristics that might position area regional councils to be the lead coordinating organization might include extensive knowledge of the region or the city, depending on the Area Regional Council, strong connection to local governments, elected officials, and other public agencies. And as I think all of the other presenters have talked, that the connection and engagement and commitment of local governments is really important to age-friendly community work. Staff with knowledge and experience in a broad range of subject areas, and that might depend on the size of the Area Regional Council. Connections with other area regional councils or metropolitan planning organizations, which again the MPOs are transportation related, and then other organizations to obtain information on trends, best practices, promising practices, etc. Area regional councils also have a culture of neutrality. That's probably more than likely because elected officials comprise the board. So a culture of neutrality is really important. I know Mark is seen as a neutral resource across our region. Area regional councils also have a pretty strong knowledge of local nonprofits, which ones are high performers, which can get the job done, which are good partners who are collaborative, so they'd be a resource to have a sense of local nonprofit participation. And then finally, potential resource for a variety of activities such as consulting, facilitation, data research, and development of tools and resources. Challenges related to funding area regional councils might include to take the time as a funder, take the time to learn the culture of area regional councils, because they may be different than the kind of funding organizations that you traditionally fund. Sometimes their mode of operation is different from nonprofit organizations. So it's just important to take out a little bit of time to understand area regional councils. Some regional planners are metropolitan planning organizations, again, transportation planning only, and age-friendly work may not be their emphasis. So it's just important to find out with the area regional council the full scope of their services. If interested in primarily funding programs that touch people, area regional councils primarily serve as planning, convening stakeholders, and development of systems. If you can move to the next slide. Questions a grant maker might ask an area regional council to determine their appropriateness to serve as the lead coordinating agency might include the important for the funder to understand the vision and mission of the area regional council and whether the proposed project is consistent with their vision and mission. Some area regional councils have a very limited scope of services. Secondly, not all area regional councils have a 501c3 designation, and assuming that this is a criteria for most funding organizations, it will be important to determine eligibility. For our case with Mark, in order to apply for philanthropic funds, we created a special 501c3 corporation with its own board, which are comprised of Mark board members. Thirdly, because area regional councils are different from many nonprofit foundations are accustomed to funding, it will be important to ask questions related to governance and management to ensure that government and management policies and practices are in place. For example, a list of board members and affiliations, length of service, bylaws, how often they're reviewed, is there a strategic plan, the time frame covered, did the board approve the grant, or will they approve the grant, how is progress reported, and where does the proposed project fit within the area regional council strategic plan. And I know that these are criteria that most funders use for all of their grantees. It's just a matter of, I think, learning a little bit about how area regional councils might be different to get a sense of how they are. With financial reporting, systems and experience in grant management, are grants approved by the board prior to submittal? How does the area regional council incorporate salary and indirect in proposals? Because again, sometimes that is different than proposals that you may be used to with nonprofits. Questions around key leadership with special emphasis on qualifications and experience of the project manager and if there are additional staff. Questions around oversight that's provided and by whom, and oversight on the status of deliverables. Who all looks at that? Also, what evaluation systems are utilized and the description of those, and then which foundations have supported the Area Regional Council in the past and for what projects and timeframes. are examples of questions that might be helpful to ask area regional councils. And then finally, on the final slide is contact information, and we were asked to provide information that if you're not sure how to contact your local area regional council, at the bottom is the website address for the National Association of Regional Councils. So with that, and I again apologize for my call being dropped, but look forward to questions.
Well, thanks, Kathy, and thank you for that information. A lot of funders are not familiar with their local regional government councils, and they can, in fact, be a great resource. So now we'll turn to your questions. We have a number that have been put in by various folks, and we'll just have probably a time for a couple. But I'll start with one for Lindsay, and this question is, could the New York Academy of Medicine have initiated the Age-Friendly New York City project without the work done by the Mayor's Commission? And I think that's also an opportunity to talk a little bit about how some existing work may fit into the work that gets done once the project gets legs and further funding.
So I think there are certain components of our work, especially our work with the private sector, that was not necessarily dependent on the mayor's office or the council taking a significant role in the initiative. So, for example, we did quite a bit of work with different professions, such as architects and librarians, creating tools for them to become age-friendly and share age-friendly principles and practices across their professional networks. But overall, I would say that the success that we've had is really attributable to having had the buy-in from the administrative and legislative branches of our government, especially where the city has control of certain services and systems that we really don't have as a nonprofit the ability to affect change in. So, the Department of Transportation, the Parks and Recreation Department. And so, it was really our role to sort of get those people around the table, listening to older people, presenting their ideas for improvement, and then, taking those ideas back to their respective agencies to say, okay, so now what can we do?
Thanks very much. A couple of questioners ask about the 501c3 charitable status, which, as I think most of our callers will know, is a requirement for most private foundations have to have a charitable organization they can give the money to, because, of course, it was charitable money when it was given, with lots of complications and exceptions. But the question is a couple things. So in several of your examples, both certainly at the university side and with Kathy, you talked about sometimes there's not a 501c3 as the host organization and the need to go out and build another one. So, Kathy, I'll start with you. How complicated was it for you to go out and create a separate organization that was able to look at private philanthropic support? And then I will come back to Alan and ask about that at the university level.
It was not difficult. It was a matter of doing it to see how that could leverage the extension of funding support for all kinds of issues that Mark is involved in. So it allowed for local philanthropic support, and it was just a matter of going through all of the processes of starting a new 501c3. So it was not difficult.
Alan?
Well, our university is not a 501c3, so we've looked for funding that leaves universities eligible as a recipient of funding. But we have, in some of our committee work, been able to get some funding for that's essentially been passed through local 501c3 partners, in particular a group called Elders in Action. And so it's been really important to have that kind of robust set of partners who can carry out the action plan here for an age-friendly Portland. There is some pushback that we've had to funders with having our indirect cost of being 26% for the university, higher for federal research dollars, but 26% for the majority of our funders. So it's also been a little, just if I can add this, it's been a little bit difficult to get funding as it's not research funding. So when we've approached various organizations in the past for research dollars, it's been really focused on a specific issue, whether it's legal issues for older adults or sustainable development as it pertains to age-friendly cities. But we haven't been able to find funding that really supports the age-friendly program as a whole. But it definitely it rules some funders out not having a 501c3 status.
Here's a question. I'll start with Stephanie on this one, having to do with creating a new program from scratch versus using a group like a local area agency on aging. What do you see as the advantages for using a AAA or similar kind of organization, as opposed to creating a completely new organization that has this as its focus?
I think I would go back to, the point that Lindsay raised in terms of, is this an initiative by older adults or for older adults? And so I think, creating something from scratch would be much harder to obtain the buy-in of the community, and AAAs really kind of already have that presence and are the go-to for the community when they have aging needs and to look for those kinds of resources. So I think, again, it comes down to an issue of relationships with other throughout the community with its residents and with other organizations in the community that are existing.
All right, thank you very much. We unfortunately got a little bit of a late start, but I want to keep to the period of time had committed to. So at this point, I'm going to ask our speakers to give us their final words of wisdom about this whole arena of choosing the correct agency to be the lead of your age-friendly community's work. And I will actually start in reverse order this time and ask Lindsay to go first.
So, one of the things that I'd like to leave you with, I actually have a background in philanthropy, so I've been on both sides of this, and I think, when funders think about age-friendly initiatives, they often think of them, they sort of group them with aging services. And so, you're sort of left thinking about the comparison of outcomes between an age-friendly initiative versus an aging services initiative, which is not all that useful, because at their core, age-friendly initiatives are planning and community development initiatives. So it's important for funders to recognize that and to not get so focused on, well, I could fund, 10,000 meals versus an age-friendly initiative. It's not necessarily the right bucket to put them all in.
Thanks, Lindsay. Alan?
I think I'd like to most push out there that universities come in many shapes and sizes, and it's really important to understand the context in which they operate. Here in Portland is an urban university that sits really within a city, a county, and a region. We are uniquely positioned to work with all three levels of government in addition to the state in some ways. So very important to explore the university's ability to connect with and to coordinate efforts that are happening in a city. And I just came back from a wonderful visit to Manchester, the University of Manchester, that's been doing work for about 10 years now around age-friendly issues, not always under the auspices of the WHO Age-Friendly Initiative. And they have a very similar approach to us, but they've been able to engage the community members and really have I think what Lindsay was talking to is this age-friendly initiative by older adults, and have integrated those older adults as co-researchers in the process, whereas we've taken a lot more of a policy approach. And so it's important to understand really what the skills and the ability of the university and the faculty are in carrying out that potential project in that potential region or city.
Thanks, Alan. Stephanie?
Yeah, I guess I'd go back to what Lindsay mentioned about the diversity of the older adults in New York. And in the report that we published, one of the key strategies we talk about is the racial and ethnic inclusion and celebrating that diversity. So, America's not just aging, it's also rapidly becoming more ethnically and racially diverse. Today, for example, 80% of Americans over 65 are white, but almost half of millennials are non-white. And minority populations often have the least access to a community's resources and also suffer disproportionate negative impacts on their health and well-being. So, so does the organization you're speaking with appropriately engage representation from all of the community's residents? Because really, including the diversity of the community's voices at a livable community or age-friendly table will lift up its various cultural assets and really also lift up the unique sensitivities and needs of each group.
Thanks. Kathy?
Well, like Lindsay, I also have a background in philanthropy, so what I'm going to say is going to reinforce what she said, because I think it's so important that building and sustaining age-friendly community efforts takes time. It's not overnight work or even work that will have long-term outcomes in the course of a one-year grant. So it may be helpful to work closely with grantees to develop reporting milestones that are meaningful to you, yet realistic for this type of work, that will help you feel good about progress that's being made. And if this type of grant is new to your foundation, you may want to consider taking time up front to facilitate a discussion or a conversation with your decision makers on the difference between impact grant making and the type of grants that may have been more traditionally funded by your organization. And certainly connecting your key leadership to organizations such as Grant Makers in Aging and other thought leaders in this field will be very beneficial. And then just a real quick, that even if you don't choose area regional councils as a primary funder for this work, I would hope that you would consider them a partner to help you in your planning.
Well, thank you all. I want to thank specifically Kathy Boyer-Sheshel, the manager of the Kansas City Communities for All Ages Project at the Mid-America Regional Council, Stephanie Firestone, the director of the Livable Communities Project at the National Association of Area Agencies on Aging, Alan Delatorre, the project manager on Age-Friendly Portland at Portland State University Institute on Aging, and Lindsay Goldman from the project director for Age-Friendly New York City at the New York Academy of Medicine. We appreciate all the wonderful work that all of you are engaged with to make life better for older persons. We also want to thank all those who helped organize the session today, particularly Barbara Greenberg and Jan Schwarz and Maria Gonzalez-Jackson. And we want to thank the sponsoring organizations, the GIA initiative on age-friendly communities called Community Agenda, the funders for age-friendly communities, and Pfizer Foundation and United Way Worldwide. We thank you very much for your attention today. We thank you for your patience with us as we wrestled with some technical issues, and we look forward to speaking to you again soon about these important issues. Have a great day.